Good afternoon. Welcome to the Office of Excellence and Diversity and Inclusion presentation for the Hispanic Heritage Month. This is sponsored by the Latino Medical Student Association. We're very happy and very proud to have very strong connections with them. In fact, I happen to be a national advisor for LMSA, very proud of that. And let me just remind you that the Hispanic Heritage Month was established in 1968 by President Johnson. It was a week, actually, of celebration. And then it was extended to a month by President Bush in 1988. We are 60 million of Latino Hispanics in the US, and our contributions are very wide and profound to the culture and the education and the science in everything in the US. And just think about it. Florida, California, Colorado, Montana, Los Angeles, and so many other words are Hispanic, are Spain, are from Spanish. So our cultural links are very, very profound. The contributions of the Latinos in the US is quite remarkable. We are 60 million of Latino in the US. There are 136,000 soldiers in the army that are Latinos. And for example, the ball pen, the CAPTCHA, which gave me such a hard time to get into this meeting today, the oral contraceptives, the color TV, the ozone layer discovery, all of those were made by Latinos. So I am very proud to let now the some of our wonderful Latino American Student Association students that are M1 and M2, Ruth Londono, Angelica Arzuaga, Juan Medina Echeverria, which are the co-presidents of the LMSA at the Chicago Medical School, to take charge of this presentation, and later on the panel for questions. So Ruth, please go ahead.
Yeah, so welcome everyone to the Hispanic Heritage Month event, MedEdPortal and Latinx Health Research. Some objectives for this talk are: describe the principle of educational scholarship, give examples of publication in MedEdPortal that highlight the needs of Latinx, Hispanic patients and communities, and list strategies for framing the educational activities to improve the publishability of their work, particularly in the new language appropriate healthcare collection. So welcome everyone, and I hope you all enjoyed the talk.
Angelica, please introduce the speakers.
Are you okay if I go one at a time and let them also speak, or should I just introduce them all at the same time?
Maybe introduce the three of them, and they will take charge of their arrangements, however they fix the presentation. Yes.
All right, sounds great. So first we have Dr. Pilar Ortega, who's a clinical assistant professor at the University of Illinois at Chicago for the Departments of Emergency Medicine and Medical Education. She directs and teaches the Medical Spanish program for the College of Medicine. And next we have Deborah Silva Diaz. She's a tenured professor of pediatric hospital medicine at the University of Puerto Rico School of Medicine with more than 20 years of experience in medical education. And last but not least, we have Hannah Turner, who is a senior staff editor with MedEdPortal and has worked with the journal Our Authors for 11 years. So I'm really glad to have you three here, and as well of the rest of the panel.
So please, the panelists, go ahead with your presentations as you have fixed that.
Okay, can you see my slides and hear me okay?
Yes.
Yeah, okay. Great, well, thank you all for having us as part of your celebration for Hispanic Heritage Month. We are very excited to be here and hope to help impart some knowledge to help you wherever you are in your publishing journey. Since the objectives were already shared, I will move forward from there, but we just hope if you have questions throughout, I'll try and monitor the chat, but this is really for you, and we're a relatively small group, so feel free to jump in with a question at any time. We did try and reserve some time at the end, but we'll see how fast we get through the content. But the goal is for you to learn something. So if you have any questions throughout, please ask. So why we're here today is to talk about educational scholarship and how you can turn some of your teaching into educational scholarship. And many people think about research as the traditional research of discovery, things that are published in JAMA or Science or Nature, but the definition of scholarship really has been expanded to include things related to teaching and learning. Because if you think about it, when you teach something, you plan the teaching activity, you research all the content and the way you're going to teach it, you use informational approaches, and you apply and integrate information and put all of that into the context of the broader learning environment. So one thing that you can think about in terms of working in research is to think about how your teaching is research. And the good news is that once you have taught a course or a section or an elective or a workshop at any different, in any different type of place, you've probably done 80% of the work for the scholarship. You've done the planning and the resourcing, getting leadership buy-in for the content. And then hopefully you've done some evaluation of what you've taught as well to improve it for the next time that you teach it to a different learner audience. And the last piece that really turns that teaching into scholarship is a piece of dissemination, and that is where MedEdPortal comes in. MedEdPortal is one of the 2 journals at the AAMC, and what we publish is discrete, standalone teaching and learning materials that are ready for immediate implementation. So the whole idea of not making other educators need to recreate the wheel. We are a completely open access journal, which means that we're free for anyone around the world to use, download, or submit to. And while that's awesome for the world of publishing, it does come with a couple of caveats that you need to consider upon preparing for submission, which we'll get to in a minute. So our mission of MedEdPortal is 3 parts. We are very committed and have been to adding to the science of teaching and learning, to disseminating the great work of educators and students like yourselves. And last year, we really solidified this 3rd part of our mission, which is our focus on author development. And this is where we want to foster inclusion into the world of publishing for communities that have been traditionally underrepresented in publishing, and provide extra support for getting work from the classroom to the internet, to disseminating. And just really quickly, I could talk about how to submit to MedEdPortal for an hour, but some highlights if you are thinking about a submission to MedEdPortal is to remember that, as a Medline Index journal, the article that's written for MedEdPortal needs to adhere to ICMJE standards for scholarly writing. So it follows the introduction, methods, results, discussion kind of format. And then because we're a peer-reviewed journal, our target audience is for resources that have been implemented with medical and dental learners across the spectrum of medical education, the continuum, But that means that that type of learner needs to have been part of the target audience for implementation and evaluation of a teaching activity or workshop. And also unique to MedEdPortal is that we don't just publish an article about a teaching activity, we publish the entire teaching activity, which means that you include appendices, which are all of the materials needed to implement a teaching activity, which means that you have to be relatively specific and discreet about what you submit to MedEdPortal. So it can't be, entire course, it can't be things that are too big for peer review, but more modular type of submissions for. Then because we are open access and we publish under Creative Commons, you as authors maintain the copyright of all of your work, but that comes with the caveat that you need to own the copyright of your work. So you need to have produced the majority of the content that you're teaching. And if you use other sources, that you are properly citing all the images and videos or figures that you use within your teaching activity. So that is a very, very brief intro into what it would take to submit to MedEdPortal, but we wanted to focus more so on, what the publishing journey is today and more inspire you all to become a part of the MedEdPortal community. And so with that, I'm going to pass it over to Debbie, who's going to share her authorship experience.
So good evening, everyone. It is a pleasure for me to be with you and be able to share how my first publication in MedEdPortal, Taking Care of the Puerto Rican Patient, Historical Perspectives, Health Status, and Healthcare Access, came to be. As background, I am a professor of pediatric hospital medicine, but I've been involved in medical education, usually in curriculum development, teaching, assessment for medical students, just like many of you, and for residents. But I did very little research, just the right amount to be able to be promoted. So, and I was not involved in educational research because in my institution, there are no resources really for it. So learning about MedEdPortal opened a whole new world for me. And I've used some of the materials that it's at this website, but I've never thought that I had something to publish. It never occurred to me until I attended a workshop very similar to this one, but a lot more granular in how to publish, that was given by Dr. Grace Wand. She's the editor-in-chief, and Dr. John Paul Sanchez, who's one of the associate editors of MedEdPortal. And they were teaching us how to write, how to go through all the process. But one of the things they kept emphasizing is that our scholarship could count twice, something that you do to teach. And I know there are a lot of students here. You don't have to be a professor to teach. I have lots of students that develop educational material to teach other students. They participate with us in faculty development. So I want you all to keep an open mind, because it's not circumscribed to being a faculty member, all right? So I approached at the end of that workshop, Dr. Sanchez, and I said, this interests me. And that's not usual for me to say that I want to do research and I want to write, and this interests me. And he, as a very good mentor, and you will hear about mentors in MedEdPortal, he asked me, what are your interests? And we talked a little bit about curriculum development. We talked a little bit about education. And then we talked about Puerto Rican healthcare in the mainland. That was one of the areas that I was interested. He immediately asked me if I would be interested in developing a module related to the care of Puerto Ricans in the mainland, right? I agreed, because many of you know that we had a very big Hurricane Maria in 2017 that destroyed most of our island. And at that time, almost 500 Puerto Ricans fled the island to the mainland US. And I was very worried about who was going to provide for their healthcare needs, because many of those were my patients. I work for the state pediatric hospital, the only tertiary care center. So we have a lot of complex patients, right? So I was worried for my patients. And this aligned perfectly. We started doing the background work, because this is research, right? It is research that has to do with education. And the idea is that you will eventually have a product that others can actually take and use and implement in their schools that is going to help others, but you have to start by the background research. And we started to create the module following all the curriculum development steps. And we had a medical student. He was with us since the beginning. He's a doctor now, Dr. Glenn Garcia, who participated along Dr. Sanchez and I. And one day I was, going my day in the hospital, and I get a call from Dr. Sanchez, and he says, Debbie, do you think the workshop, the module, will be finished by Hispanic Heritage Month? This was 2019. And I said, oh, yes, that was like 3 weeks, a month away. I was thinking that he was asking for submission, for revision by someone. But then he said, well, I have 7 schools that are interested in participating on this project. They think this is an important topic and they want to participate. And they are inviting us to implement the project, present the teaching materials, the workshop at their schools. And that's what we did. We presented at 7 medical schools, and the data that we received from the evaluation was used to analyze the effectiveness of our module, because again, this is research, right? So at the end, you need to have some type of data that evidences that what you're doing gets the results that you stated you wanted to achieve. And of course, because we had the data, this led to a publication. Now, one of the things that I thought was amazing about this process, and for me, this was totally new, right, was the ability to collaborate with colleagues in a project very close to all our hearts, but we were not even in the same place, and we didn't really know each other one-to-one. So mentors at MedEdPortal, and at least my mentor, Dr. Sanchez, really helped us all get together and streamline this and do it step by step. And at the end, I actually was able to have my scholarship count twice. The module we developed was for faculty and medical schools and healthcare professions at the mainland, and we were able to implement it in 7 medical schools, and at the same time get it published so others can use it. Now I'm gonna let Pilar tell his story.
Can you advance, Hannah, please? Perfect, thank you. So buenas tardes, great to see everyone. So my story is a little bit different, and I think that's why it's wonderful to hear different people tell their story of how they began to publish in MedEdPortal. So you can see that it's very possible to arrive at this place from very different paths. So for me, I was actually like one of you, a medical student, when I started teaching. Specifically medical Spanish. So the way that all happened is, of course, the same as many of you might have encountered yourselves, where there wasn't a course already existing or operational at that moment at my medical school. So I decided, as I was learning how to do a clinical interview in English, well, why couldn't I, think about how to do that in Spanish? I already had the professional level Spanish skills from my prior training and schooling. So why not apply it in this way? And, time goes on, and this became actually my main fields of expertise, and area that really was pretty much non-existent in the academic space in medicine before I started developing some of this work. So I started teaching medical Spanish as a student. I did it as a resident, and then I did it in my first job out of residency. And I didn't really I was just making up the material as I went, right? So one of the things that, when I started seeing other people had publications in MedEdPortal, other topics were published in MedEdPortal, yet when you search Hispanic health, Spanish, anything like that, nothing. There was literally nothing. And so then in conversations with others, including Dr. Sanchez, who Dr. Silva just referred to as well as a mentor for her, I realized that there was an opportunity here. So I think one of the sort of conceptual differences between publishing in other journals that we'll get into a little bit more in a bit is that the curricular components are so central to a MedEdPortal publication. And because I was coming at this a little bit in a reverse direction, meaning that I had already developed my curricula, I was already teaching and implementing my curricula. Thankfully, data collection was something I had been thinking about from long before. So I had been collecting some data on my course evaluation process. So I was able to take some subset of that data and say, okay, what is a bite-sized chunk of the curriculum, full medical Spanish curriculum that I have developed that I could publish so that somebody else could implement it. So that's where this publication came in, which is focused only on one of the modules that we do in our medical Spanish course, which is, in this case, the musculoskeletal and dermatologic educational module. So it can be implemented in lots of different ways, either as part of a medical Spanish course or as an independent module all on its own, maybe for folks who are, for example, in orthopedics or dermatology, or in lots of other fields, so that they can work on their skills. And as you can see, the appendices here on the right side of the screen, there are lots of components to these publications, and we can kind of talk about that a little bit more as we go. Some of them have many different appendices and others have 2 or 3, but you always have to have that. It has to be self-sufficient so that somebody could pick this up and use it on their own as a facilitator. So I think that's one of the wonderful things that MedEdPortal offers, is that you are able to, have everything in one place and be able to use it. And now, because I do so much mentoring of other people who want to teach medical Spanish, one of the things I tell them is, so you can see the activities that I do in my course, check out this publication, right? And then they can see exactly what we do in the course during the time period for each module, using this one as an example. So I'll stop there, and then we'll go into some of the specifics of the call so that you all can hopefully get inspired. Next slide. So we're really excited to tell you about this call for submissions, which I'm extremely proud to be a part of. It is the first time that U.S. Journal is specifically calling for content that includes content in non-English languages. So that in and of itself, and on Hispanic Heritage Month in particular, is something in and of itself that we need to really celebrate as a huge advancement that you guys can be a part of, hopefully, as authors. So the website on the bottom is where you can see all of the details of this call, but we're going to kind of get into some of the rationale behind it. What are the types of papers we're looking for? So you know us already, I think. So the overall purpose, we have kind of 3 main goals with this call and what we're trying to do with this call. We want to encourage educators across the health professions to submit educational materials that are generalizable, and we're going to talk about what that means in a little bit. And we want the focus to be on these 2 categories: language appropriate healthcare and medical language education. We're going to show you some examples so that you understand what those things even mean, which I think illustrates what we mean by that. We want to, of course, take this opportunity to elevate educational scholarship in this field. It is medical language education overall is an emerging field, as I was telling you from my own experience. So this is a great opportunity to really get a collection, a groundswell in articles that focus on medical language education. And of course, as a result, we hope we can convene a community of scholars in this field who can really feed off each other and increase overall the scholarly presence of this field. So some of the kind of background in as we were thinking about how to frame this call, it's really important that we rethink, how we've thought historically about language. Historically, we talk about a lot, or we hear a lot about language barriers and language as something that blocks the way that we're able to provide healthcare. But instead, I challenge you all to think about language as a medical tool that we actually use to give high quality care and to communicate with our patients, to diagnose them, to treat them, to connect with them, to build rapport, etc. So language identity in and of itself is complex, right? And you know, this month we're celebrating Hispanic Heritage Month. So I know from my own experience growing up as a Spanish speaker first and then learning English in school, for sure, language in our community is something that intersects with other aspects of my identity, of our identity. So it may intersect with your race, ethnicity, culture. It may intersect with your immigration story, with your family's immigration story, with what nationality or ancestry you come from. It may have something to do with your or your parents' access to education. Sometimes people have different ideas about, you know, if my child is bilingual at home, then they're going to be perceived differently or put in, you know, these certain courses. So I don't want to encourage that. Whereas in different parts of the world, bilingualism and multilingualism is perhaps raised up in a different way. So it also intersects with health literacy and how much knowledge we have about our health. So all of these concepts interact with each other in complex ways. And although historically we focused on what are the languages that our patients speak, it's time to also focus on what are the languages that our clinicians or physicians speak, so that we can actually encourage language concordant care and support the education of those who have bilingual skills as physicians. Next. So we know from research that patients who have non-English language preferences have worse clinical outcomes. That's a really important concept that we, that's really at the background of all of this work and why it's important to publish more and increase training on medical language education and language appropriate healthcare. We also know that which we learn in medical school, i.e. the standard use of language to communicate with patients, doesn't work for all patients, right? So including some of those who may not speak English proficiently, but also patients with sensory or cognitive impairments. So there's a huge subset of other patients that not necessarily because of language, but because of other communication differences may not effectively be receiving the communication from their healthcare professionals that they could and should be. And there really is not much out there, right? So there's a paucity of curricula focusing on these topics. So the submissions that we are looking for, we would like to see submissions that teach language concordant clinical and communication skills relevant to specific populations with non-English language preferences. Spanish is one example, but it is not by any means the only one that we are looking for. So we would like more publications that teach language concordant skills. The second type of submission is that we would like to see manuscripts and curricular materials that teach clinical strategies to effectively communicate with patients who have particular sensory or cognitive needs. For example, individuals with autism, how do you effectively communicate with them? And that's just one example, but of many others. Sign language is another one for those deaf or hard of hearing. So there is almost nothing published on these topics right now, and we'd really like to see that change. And the third area in which we would like to see submissions is teaching knowledge and clinical skills to collaborate with medical interpreters or other members of the healthcare team, so that together we can enhance language appropriate care. So in this subset of submissions, we want to see those that not, in this case, the target is not to increase the language skills of physicians, but rather their ability to work with language resources, medical interpreters, et cetera. So equally important and necessary for language appropriate healthcare. So with that, I'm going to pass it on to Dr. Silva.
So as any other journal, there are guidelines, and anybody that is interested, and I hope you all are, You can go to the Author Center. The guidelines in MedEdPortal are very easy to read and understand. I've entered other journals and sometimes I don't even understand, but in MedEdPortal, they're very quite straight. And we all need to follow the guidelines that have been developed for language submissions, right? They have to be, all the submissions in MedEdPortal need to be generalizable, additive, accurate, and usable. Next. And by generalizable, what we mean is that what we are providing, what we're submitting, can be used by the continuum of medical and dental education. So MedEdPortal requires that we provide in our teaching medical and dental education in any step of the continuum, but it can also have other healthcare professions included. For example, when we were implementing our workshop, we had all healthcare professions were invited to the different activities, and that was part of our data. It should feature clinical scenarios that can be used by many institutions, right? And I know that sometimes you say, yeah, but what's many? So, this is open, but some areas have populations that might be big in numbers in an area, and that can be considered, right? So we need to evaluate that, but we need to make sure that not just a very small subgroup can only be taught with those materials. Next. Additive. So the submission has to be a meaningful contribution. So it means that it's not just translating from English to Spanish or from English to any other kind of language. And the best of those would have clinical topics that are, like Pilar said, are pertinent to communication and shared decision making, and very central to that specific community's needs, which are usually based or associated with our backgrounds, cultural, ethnic, religious backgrounds. Next. And accurate. So for submissions where you are going to submit part in non-English language, let's say that some of you decide to submit a tutoring session that you've been doing for your medical Spanish course, right? You might have one and you do within yourselves, and you get a faculty member to help you and to guide you, and then you get Pilar or I as your mentors. And then you need to make sure, right, that what you're submitting in Spanish, in this case, has quality non-English content. And that means grammar, spelling, medical accuracy, and even linguistic practices, right? Be inclusive. Next. And it has a section where we have to write. And the methods section, we would all need to describe what were those strategies that we used to ensure that the content in the non-English language is adequate and is accurate. And these are some examples. So you can get professionals with a high level of proficiency in the target language to develop the materials or to review your materials. You can get a professional translator, translation service, or you can translate the materials from the target language and then back to English to ensure that they are accurate. So these are just some examples. And now I'm going to give it back to Pilar.
Great. So this is something so unique, right? That we get to include material in a language other than English to a U.S. journal. So we have made some guidelines to help authors maintain that high quality that is expected of your English, of the English portions of your publication. The same quality standards are going to be applied to the non-English portions, but how do we do that? So one important aspect is that you will need to provide English versions of your non-English content. This allows editors who may not have skills in your target language for your publication to still review the content. We also strongly invite you to recommend potential reviewers who are proficient in that target language. And there is a place when you submit in the submission portal to indicate why you are recommending a specific reviewer. So including this person has proficiency in X language is really helpful for the editorial staff to identify appropriate reviewers for your publication. We will be aiming for any material in a non-English language to be reviewed by at least one peer reviewer who has expertise in that language. And if you can facilitate that, that will make it all the more likely that your publication will proceed smoothly through the process. So we did provide some tips on the website that you can read in more detail about, what are the kinds of things that you should do to make sure that your language usage is appropriate. So I strongly recommend that you take a look at those in greater detail. But some of the things that I want to point out is that we are trying to go away from terminology like language barriers and limited proficiency, because these are limitation or deficit oriented mindsets regarding language. And we want to move forward with a mentality that is more positive and viewing language as an opportunity and a medical tool instead. So we have some suggestions. You can find those on the website as well for MedEdPortal for how to think about phrasing or framing some of the background for your publications. So we wanted to share with you a few examples that are already a part of this language collection, because I think that this is the best way for you to see what type of things we are looking for, and just highlight a couple things about these publications that have made them successful. So this particular publication is COVID-19 education for health professionals caring for Spanish-speaking patients. One of the really important things about this and other things that we're looking for in MedEdPortal is that they really should be interactive. We want engaged learning. So it is not enough to provide, for example, a list of vocabulary or something like that. You need to provide activities where the learner will actually be engaged in the learning process. And so that's one of the things I really like about this publication, where there is a slide presentation component and a kind of this didactic component, but then there's also a video of a patient encounter that is included and you can download from this publication. And then there's some scripts for practice purposes. This is another publication that I have in MedEdPortal. So similar to the previous one that I talked about, we focus on a discrete module that can be implemented at another institution. And we provide a few things. We provide some guided clinical questions where there are various cases and some guided questions that the facilitator or the faculty member can use to guide the students through a case. We provide role play scenarios. And then there's a specific guide that tells the faculty member what to do throughout the part of the session that is synchronous with the students. And there's some material for self-study as well for students, and then a post-test. Next. It's really important to us that this collection represent a lot of different languages. We know that 350 languages are spoken in the United States, at least. And we would like to see more of them represented through medical language education and language appropriate healthcare publications. So this is an example of a publication that focuses more on cultural humility and cultural competency than linguistic skills specifically, and is focused on Arab and Muslim health education in a medical school curriculum. So they have a video as well integrated within here, some small group sessions, and cases for discussion, as well as a slide presentation. And then this example, Lost in Translation, an OSCE-based workshop for helping learners navigate a limited English proficiency patient encounter, is a great example of a way that you can integrate language-appropriate healthcare. So not necessarily teaching a language or about a specific culture, but how to navigate a situation in which you need a medical interpreter. So this one focuses on pediatric population and effectively working with interpreters, and they have some video demonstrations, some scenarios, and some materials so that you can actually use to actually have an OSCE as well at your institution. I'll just mention as we proceed to the next steps, because I saw that there was a question about can we use this in Salud workshops that you have in the community, and that's really a great question, Ruth. So I think there is a way that you can do that. I think one thing that I would alert you to is that the audience, the target audience for MedEdPortal publications has to be principally medical students or medical students, dental students, or above. So for people further in their training. However, your sessions that are focusing on teaching skills to community members who are Spanish speakers, the way that you can integrate this into a MedEdPortal publication would be, how do you train the people who are running those sessions? So let's say if that session is run by medical students and you are training a group of medical students every year to become, people who talk to the community about improving their health in Spanish, how do you train them? So that is what I would focus on for a publication. And absolutely, I strongly encourage you to consider that.
Sorry, I'm on multiple screens here. So thank you, Debbie and Pilar, for sharing those concrete examples, and hopefully it sparked some ideas for those in the audience about how they could potentially contribute to that call for submissions or collections, either, tomorrow or in a year. So these calls do last a while. So we hope that if you're thinking about developing a curriculum, you can still submit it eventually. And even when the call ends, it doesn't mean our interest in the content ends. So we'll always be open to this type of content. But another way to get involved with MedEdPortal and kind of learn about what our submission standards are and what other people are publishing is to be a reviewer for MedEdPortal, which you can do when you have a terminal degree. So sorry to the students in the audience, but once you get your MD degree, you can sign up to be a reviewer just by emailing your CV to mededportal@aamc.org. And that's another way to kind of get involved in the world of scholarship and keep your ear to the ground, I guess, in terms of what others are producing at their institutions. And in addition, Debbie and Pilar have created a submission do's and don'ts. So if you are in the process of thinking about submissions, they created this table, which is on our website at this address, to outline kind of ways to think about, concrete ways to think about what you could and couldn't submit related to the 3 aims of the call that Pilar explained earlier. And for those interested, we have set up a special group mentoring session. So if you have an idea of a submission that you'd like to work on with Debbie and Pilar, they've volunteered another hour of their time, which we so appreciate, on October 11th at noon. And if you're interested in participating in this session, bringing a submission idea, or just have questions or just want to talk to them a little bit more, you can by emailing mededportal@amc.org, and we will send you the Zoom link for that session. And we will ask that you fill out, we have a kind of a templated version of the ESR to help you start to think about how you frame that, how you're going to frame your submission. So we'll if you email us, we'll send you this template with the Zoom link so you can start kind of preparing for what kind of questions you'll have for them. And if you can't make that session and in 3 years you think about submitting to MedEdPortal, hopefully we still have this process in 3 years, but we do have a cohort of faculty mentors who are authors and reviewers that love MedEdPortal so much that they want to help others submit successfully to MedEdPortal. And we foster this group with we educate them on, as our submission policies change, and the staff are very closely involved, and they have monthly office hours. And also we have one-on-one mentoring. If you have submission ideas, you can also access the faculty mentor website within our journal and fill out that same ESR workshop and get paired with a mentor who can help kind of work you through the initial stages of developing your work for submission. And next, if you follow us on Twitter, we are going to be working on a scholarly writing series next year that might help also for those who are interested in getting involved in scholarship. And this will include like tips to think about, titles and how to write a good abstract and all those types of things that are skills that kind of build up into being a successful author. So follow us on Twitter for more announcements on when that comes. And lastly, I just want to share that it's not my baby, but I'm a part of it. It's a book that's coming out targeted for the Latinx population, trying to encourage everyone to increase their contributions across the spectrum of medical education. And this is a JP Sanchez baby as well. MedEdPortal is featured in one of the chapters, but it's really it will be a comprehensive book about all things academia and how you can get involved and kind of lifting the trunk off of the processes for, everything that's related to advancement in academia. So that's also coming down the pike for those who are interested in education. And with that, we have our contact information here, and we have 7 minutes left. If others have questions, we are happy to answer them. If you have any type of question, we're happy to answer it. And are just really excited to have been with you guys for this hour and hope to see your names coming through the submission portal. We have lots of learner authors all of the time. So, yeah.
Thank you so much. Juan Medina is moderating the question session. So if you want to raise your hands, and Juan will address the questions.
Yeah, thank you so much, Ms. Turner and Dr. Soul and Dr. Ortega. This was amazing. I got a couple ideas now. Ruth, do you have a question? Go for it.
Yeah. So in terms of like the mentorship, how does it for example, I've involved with like the interpreter section in we have like a free clinic at the school, and then we offer interpreting services for it. And I'm just thinking like in terms of like the submissions for like, how does it work? Like what we found that was helpful, or like in exploring that type of idea, or what could be helpful, and publishing something through the portal. Do we just like email one of you and like talk about what we think, or how would that work?
I can start with this one. So Ruth, you have lots of ideas, and I'm excited. Really excited that you are already thinking about multiple different ways that you can contribute. And I think it would be probably really helpful for you to come to one of these mentoring sessions, like the office hour that we're going to have in October. So that way we can have a little more dedicated time for you to talk to us about your ideas. Before that, I would just ask you to do a little bit of homework, which I would say one would be make a list of the various ideas that you have, and then choose one of them that you think is the most ready, the most close to something you would want to start publishing. I still ask you to make the list, because what if that one that you think would be a good idea, that is your best one, maybe we might say, well, for this reason or that reason, it's maybe not the best fit for MedEdPortal. So it's good if you have a list so we can think through. But for the one that you think is closest, I would like you to start filling out, even if you can't fill out the entire thing, this worksheet, faculty mentorship worksheet that MedEdPortal has. I think that will be super helpful for you to clarify your ideas on the matter, and then also for us to see, and then we can really give you more specific guidance. I don't know if there's a link, Hannah, where directly to that worksheet that maybe we can even pop into the chat.
Thank you so much.
Thank you, Dr. Ortega. And Dr. Resgado, you had a question? Oh, I think you're muted, Dr. Resgado.
Yes, thank you very much. It was fantastic, and it certainly, we can see, is opening the minds of our students. One of the goals of our dean at the medical school, of the very important goals, is to have students publish. That's clearly stated, and we want to promote that as much as we can. That's why we choose this very topic for the Hispanic Heritage Month. And so this is wonderful that our students are beginning to think about that. Now, would you please comment on these kind of publications about the two things, IRB approval and CT training, please?
So that is so from a journal perspective, IRB is an institution-specific policy. So whether or not educators need IRB approval for what they're working on is specific to every institution. Some institutions it's exempt, some institutions you need to go through the approval process, some it's quality improvement, so every institution is a little bit different. But so that's probably best answered within your office in advising students on how to proceed with that. But I would say that most MedEdPortal submissions have gone through an IRB process prior to submission. So, a lot of education is published over multiple years, or implemented over multiple years and then published after, year 3 or 4. So maybe they did IRB in year 4 and not in year 1 because it was just education at that point before they thought about publishing. But thinking about IRB early, as I said in the chat, thinking about publishing early is never an issue because it also helps start to frame the work that you're doing. A lot of your IRB application can probably be used in your introduction section or your needs assessment, all those components of the article piece, the ESR. So yes, if at your institution you need to do city training and then IRB, I would recommend that. And also another way that Pilar and Deborah can also speak to is students working with faculty members who might have already done that or, have more experience with how to do that at their institution. A lot of collaboration between a student and a mentor or senior faculty member is what we see a lot of as well.
Yeah, I agree. I mean, I think in general, you should think about the IRB, think about that really early. It's probably going to be an exemption because almost all educational work is, going to qualify as exempt. So it tends to be a pretty easy process, but if you don't have it, it's something that could be later an obstacle to actually getting published. So IRB is the Institutional Review Board, which is the part of, there's a office in every medical school, hospital, et cetera, that will approve any study that involves human subjects in order to protect the human subjects. So even if your human subjects are students and you're like, well, what could be bad about like asking them a few questions before and after each course, right? But anyway, we have to protect any data, especially that could potentially be identifiable. So that's a really important part of the process that you need to think about early, just so you can get it, done. If you're working with a faculty member and maybe it's a course that's already pre-established, they may already have an IRB, actually, that might cover some of the work you're doing. So that's another thing, that to think about, so you don't have to necessarily do redundant work, but definitely think about that early on.
And find out what are the regulations of your institution, because like Hannah said, they're all different. Like in my institution, students do need to complete city training and IRB, but we are the primary authors. So it's really finally our responsibility to make sure that everything is the website and to be exempt. So, you need to find out how it works in your institution.
Thank you, Manuel. Juan, would you like to close the session?
Yeah, I just wanted to say thank you so much, Dr. Ortega, Dr. Soba, and Ms. Turner. I think it's really nice, especially for the M1s that that are coming in. The idea is sparked now. Like Ruth was saying, like she's really interested in publishing now. So it's really nice, and I thank you for your time on this busy week. So thank you so much for your time.
Thank you.
Thank you. Buenas noches.
Buenas noches.
All the goals were accomplished. We're we're thrilled of your participation. Thank you very much.
Thank you for the invitation.
Muchas gracias por todo y buenas noches.
A ustedes.